Okay. Hi, everyone. Welcome back to my channel. This is Aging with Andrea. I hope all of you are well and taking care of yourself. And it's almost Halloween, so hopefully you've had a spooky October. um, so today I thought I would do something a little different. Because I don't really know how to edit a video, I thought I would just walk you through a PowerPoint that I created for my internship recently. Um, I'm really proud of it, and I think there's a lot of beneficial information in it worth sharing. So that's why I thought I would come on and talk about it for a little bit. So, health literacy is something that now I know a little bit more about it, but I wasn't super informed on it. And I feel like it's something that we don't talk about a lot, especially when it comes to with older adults. However, hopefully after um, watching this PowerPoint and me talking through it, um, you'll also see why it's an important topic to discuss. Um, I'm not an expert by any means, and I will also put down below the links to where found all this information because it's obviously not mine. I don't have a sources slide on here, so I'll go ahead and put that in the link if anyone is interested in learning a little bit more. And with that, I guess I'm gonna get started. Mm, Maybe. Here we go. Okay. So first, I thought I would discuss health literacy versus literacy itself. So they're closely related, but they're not identical. That's important to remember. So literacy is a set of reading, writing, basic math, speech, and comprehension skills, whereas health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So obviously, health literacy kind of self-explanatory, but just keep that in mind. Um, so health literacy and the Healthy People Initiative of 2030. This might be something that you're familiar with or not, but I'll go into a little bit about it in a minute. But the definition of health literacy, it was updated pretty recently, August 2020, with the release of the U.S. government's Health People 2030 initiative. So the update addresses personal health literacy and organizational health literacy, and provides the following definitions. So for personal health literacy, it's the degree to which individuals can find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And then organizational health literacy is the adoption of a definition for organizational health. Literacy signals that personal health literacy is contextual and that organizations play a critical role by making health information in series easy to understand and access. And we'll talk about both of those a little bit more later on. But you can see, move my face here. So there's the Healthy People Initiative of 2010 and 2020. Right. Yes. Yes. So it's been going on prior to 2010, but we're just going to talk about the last two decades. So in 2010 and 2020, the definition for health literacy was the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So this new definition that we talked about right here are these two definitions. They emphasize people's abilities to use health information rather than just understand it, which is super important. Um, and then it also focuses on the ability to make well-informed decisions rather than just the appropriate ones. And then it incorporates a public health perspective, which is also important. And then lastly, it acknowledges that organizations have a responsibility to address health literacy. So a little bit about Healthy People 2030. Told you we would get to it. So this is the 5th iteration of the Healthy People Initiative, which provides science-based national health objectives with targets to improve the health and well-being of Americans. So for the first time since its 1979 establishment, so it's been around for a little while, the Healthy People framework aims to attain health literacy as an overarching goal and foundational principle to achieving health and well-being. So they're really focusing on health literacy this time around, which is awesome. Growing literature on healthy literacy describes it as a concept not solely reliant on individual capabilities, but also on organizations' ability to make health-related information and services equitably accessible and comprehensible. So that's why they have both the personal and the organizational definition, which I think is really good because it is kind of taking a systematic approach, which I mean that's one of my one of my personal favorite approaches, because I think it just covers a lot more ground and considers a lot more. So versus just focusing on the personal or just organizational level. Um, so the importance of health literacy. So yes, I've told you about the Healthy People Initiative and health literacy and how it's, addressing it. And it's so why should I care, Andrea? Good question. Let me tell you. So at some point in all of our lives, we need to be able to find and understand and use health information and services. Um, Most likely you've already done that in your life at least once, or you've done it on behalf of someone else if you're a caregiver. So taking care of our health is part of everyday life, not just when we visit a doctor or a hospital. And when we use health literacy, it can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that happen. So you're able to grasp the situation a little bit more when you're illiterate in health literacy. So even people who read well and are comfortable using numbers can also face health literacy issues when they're not familiar with medical terms or how their bodies work just in general. They must interpret statistics and evaluate risks and benefits that affect their health and safety. They're diagnosed with a serious illness and are scared and confused, and that kind of takes over those emotions. They have health conditions that require complicated self-care, and they are voting on an issue affecting the community's health and relying on unfamiliar technical information. That's a really big one because a lot of the political things, especially in voting, just policy and political talk in general is just not made for the average Joe. And so when we add in, health issues and things like that into the equation when we're talking about policy, it just goes over. I mean, I don't know about you, but I personally glaze over a lot of times. And I'm almost done with my master's. So, and I know personally, there's sometimes where where there's health things that I just glaze over. So it can happen to anyone. So the importance of increasing health literacy. So I just wanted to share some statistics and facts on why it's important. Um, so nearly 9 out of 10 adults have difficulty using the everyday health information that is routinely available in our healthcare facilities, retail outlets, media, and communities. That's staggering. Um, Without clear information and understanding of prevention and self management of conditions, people are then more likely to skip necessary medical tests, they end up in the emergency room more often. They have a hard time managing chronic diseases such as diabetes or high pressure, which are very common. People need information that they can understand and use to make informed decisions and take actions that protect and promote their health. And health literacy is a part of a person-centered care process, something that this country really emphasizes, but really isn't good at practicing correctly. It's essential to the delivery of cost-effective, safe, and high quality health services. Because think about it, the the more a person is in and out of the emergency room because not they don't have good health literacy, it's more expensive for everyone involved. So low health literacy also affects people's ability to search for and use health information, adopt healthy behaviors, and act on important public health alerts. So there's just a lot to consider there. So implications of limited health literacy. Adults with limited health literacy skills report feeling a sense of shame about their skill level, and as a result, they may hide their struggles with reading or vocabulary and then never improve. And then as a result, um, then the amount of actual people who have limited health literacy, it's not available or truly accurate because it's kind of an invisible issue. Um, so then how can we work on it truly if we don't have the actual numbers, if that makes sense? So those with poor health literacy, and also if people like health professionals don't think that health literacy is a problem for more people, they're not going to focus on working on making their information more easily accessible and easy to read and understand, comprehend. So those with poor health literacy are more likely to report that their health that their health is poor, and that they're more likely to lack health insurance than adults with proficient health literacy, which is really concerning. The lack of use of preventative services, management of chronic conditions, and self-reported health come with having poor health literacy. And they're also more likely to misunderstand the prescription medication instructions and have medication errors and poor comprehension of nutrition labels. And that medication and prescription instructions, that's a real problem because it then may or may not lead to substance use or misuse, abuse or misuse, which is a whole other issue. So that's something that we need to consider. So who exactly is impacted by limited health literacy? It affects people of all ages, races, incomes, and education levels. It does not discriminate. Like I said earlier, you can have perfectly good reading literacy and just literacy in general, but your health literacy may not be on that same level as your literacy level. However, it does typically affect lower socioeconomic and minority groups more disproportionately. Um, so, like I said, though, a person can have completed the required number of years of school and still have limited health literacy. In fact, approximately 45% of high school graduates have limited health literacy. And I'd be interested to see um, the numbers on those who have graduated college too, because I feel like, or even graduate school. Yeah. So certain populations, though, they are more likely to experience limited health literacy. Um, One of them is adults over the age of 65, which we're going to talk about in a minute. But I wanted also to highlight that it's again, it's a racial and ethnic issue. So the basically any group other than white individuals is more likely to have limited health literacy. Recent refugees and immigrants, people with less than high school degree or GED, people with incomes at or below the poverty level, and then non-native speakers of English are also um, at a higher risk of having limited health literacy. Okay, so I wanted to talk a little bit about older adults and health literacy because typically older adults utilize more healthcare services, they have more chronic conditions and take more medications than any other age group. And they also have the lowest health literacy levels of any age group, which is alarming. The two of those things do not work well together. So some statistics to show just the gravity of this. 71% of adults older than age 60 have difficulty in using print materials. 80% have difficulty using documents such as forms or charts. 68% had difficulty with interpreting numbers and doing calculations. And then only 12% of English-speaking adults in the United States have proficient health literacy skills. So there's a lot going on there. So some strategies to ease cognitive challenges with literacy. So aging results in normal changes in cognition. There's 3 specific changes that occur. There's reduced processing speed, there's greater tendency to be distracted, and reduced capacity to process and remember new information. So in order to deal with those challenges when you're providing information to an individual who might have dementia, Alzheimer's, or just they're a little older and they're just going through normal memory loss, you can do the following things as a professional and as a person in general. Repeat the essential information. I know a lot of us don't like to repeat, especially when we're talking to older adults, but sometimes it just takes another time or two to really get it into the person's head. Focus it on the important meaning of the information and the gist. That means cut everything else, get to the point, and really focus on that. You want to use plain language. And then you also want to emphasize directions that the person must follow. You can use reminders to aid the memory, like giving them a brochure or a pamphlet to bring home. And then also include skill building activities with your information to reinforce meaning. So visual challenges and strategies to ease those when you're providing information, health information to older adults. So a lot of Older adults have problems with their vision as they get older. About 2 out of 3 adults with vision problems are older than 65. So when you're providing information to them about their health, you can use these strategies. So make the information easy to see and read. So text should be printed with the highest possible contrast. Um, Ideally, the best contrast is using black text on a white background. I know it's not, fun, sometimes it's fun to use different colors and things like that, but it's just it make it aesthetically pleasing and fun, but it's just something that you need to consider the audience and their needs when you're making information. So font size, you want to use 16 to 18 point font size or larger when developing the materials for older adults. So they don't have to use a magnifying glass like this lady. And then you want to have spacing between the lines of text. So people with low vision may have difficulty finding the beginning of the next line when reading. So make the space between the line of text at least 25% of the point size. And then paper finish, you want to avoid paper with a glossy finish because it can cause a glare. And then just to reduce the amount of text, you could also provide audio information. And then again, use black text on a white background for the best contrast. So you can see I kind of used that for this presentation, and it's very easy to read compared to like color or white on another color background. So just something to keep in mind. And then strategies to ease hearing challenges. So hearing loss is also common in older adults. It affects 1 out of 3 people older than 60 and half of those older than 85. So you can use the following strategies with people who have hearing challenges. So you can limit background noise when you're talking to them, speak clearly with more volume, but it's important, do not scream. You don't need to scream if a person is hard of hearing. It's not going to help. And honestly, it just comes off as aggressive. Excuse me. So you want to speak clearly, make sure you're not going fast, because sometimes when we talk, everything kind of goes together and like, no, you want to talk clearly, slow, but not slow, like condescending. There's just a very fine line, but I would encourage you to really be aware of that if you're a professional that works with older adults, and just even when you talk to older adults in your regular life, if you're not a professional and you just happen to be watching this. That's always been a pet peeve of mine. I've had, when I worked at the assisted living center, there was staff that would scream in residents' faces because they were hard of hearing, or even if they weren't, and it doesn't help. So when you're talking to them, do not chew gum or eat while speaking, because it just deteriorates the speaking clearly of it. And then always talk face to face. Don't have your back to the person. Don't be looking over here, because sometimes people will use your mouth and to translate, read your lips and things like that, and watch what your mouth is doing and things like that. And it's also just polite. So when you're designing materials for older adults, here's some key things to consider. So you want to provide short, concise health messages that detail the specific action steps your older adult audience should take to achieve the desired health goal. just short and sweet. Don't put too much, kind of like what we talked about earlier. And also something that I thought was important to mention, make it empowering. You want to emphasize the self-determination or the older adult um, having control of their own health. When people get older, things start to, especially if they have health conditions or dementia or things like that, um, they start to lose control of their life, especially if they need care or things like that. So you want to make sure that you frame your message so older adults feel confident that they can use this information in a way that will impact their lives and that they can do this on their own. It also is important to make it self-directed. So older adults like to learn new health information through a variety of methods. While some may prefer to receive information through spoken or printed words, others may be a visual learner, and some a combination of both. So you want to think about using different approaches to present your information. So you could have a pamphlet or a brochure, and then you could also have a video or an audio tape format of the same information, just so it's able to be accessed by everyone and comprehended. So I wanted to talk a little bit about the history of health literacy. It gets a little policy kind of, so bear with me. But so we have to go all the way back to 2000. So in 2000, the Healthy People 2010 initiative identified limited health literacy as a public health problem and set national objectives for its improvement. And then in 2004, IOM reported findings that health literacy is critical to improving the health of individuals in the nation. And then at the same time, in 2004, the Agency for Healthcare Research and Quality published a thorough scientific review of the literature on the effect of limited literacy on a wide variety of health outcomes. Then we go to 2006, the US Department of Education released the first ever national assessment of the health literacy of English-speaking adults in the United States, showing that limited health literacy is a widespread problem. And then today, health literacy is increasingly receiving attention from major health professional organizations, and then recent research highlights the severity of limited health literacy. We kind of talked about that a little bit back in the previous slides. So it's just kind of cool to see it all pieced together. Okay, so I believe I mentioned the Health Literacy Action Plan. If I didn't, I'm going to now. So the Health Literacy Action Plan is the result of many years of work by numerous public and private sector organizations and individuals to draw attention to health literacy as a major public health issue. So they saw all of this happening and said, okay, we need to make a plan. So the Health Literacy Work Group of the U.S. Department of Health and Human Services led the preparation of the plan. The plan was based on the 2006 Surgeons General's workshop on improving health literacy, which was a series of town hall meetings in 2007 and 2008, and feedback from stakeholder organizations in 2009. So they took all that and put together a plan, and then the release of the plan is only the beginning of a coordinated process that will result in a society that is more informed, empowered, and engaged in health protection and promotion. But overall, the action plan kind of emphasizes that through interconnected multi-tier and multi-sector approaches, we can improve the accessibility, quality, and safety of healthcare, reduce cost, and improve the health and quality of life of millions of people in the United States. So I just wanted to talk a little bit about the importance of health information. So health information comes from different sources, many different sources. And it's delivered through multiple channels. So friends and family, TV, radio, newspapers, websites, and social media. Also health professionals. So many of these sources present different and possibly conflicting information, as I'm sure you are all aware. And some present biased or incomplete information. So as a result, people confront a complex and potentially overwhelming set of health messages every single day, which is yeah. So to prevent or manage disease and promote health, Americans need to make sense of the health information they hear, read, and see from all of these sources, which is why health literacy um, and increasing health literacy is all that more important, especially in the COVID era. Um, so all of us must work together to make sure that health information and services are provided in ways that meet the needs and interests of all people. Although many individual factors contribute to limited health literacy, eliminating barriers and improving the way healthcare and public health professionals, educators, and the media communicate health information offers the best opportunity to achieve a health literate society. So, some strategies for organizations that develop health information. I won't talk about all of these um, at the risk of making this video extremely long. If anyone is still here, I appreciate it. But just some strategies that I thought were important. Just participating in ongoing training in health literacy that focuses on improving clear communication and information design practices, I think is really important. I also think involving members of the target population, including persons with limited health literacy in planning, developing, implementing, disseminating, and evaluating health and safety information is beyond critical and essential. And I think I wish we did more of this. Um, I can understand the barriers to doing that, but I wish it was more of a reality. And then I also just think ensuring that health and safety information is culturally and linguistically appropriate and motivating, especially for those populations that are more at risk for having lower health literacy and need that information more. Um, yeah, so yeah, again, I won't go through all of it, but there's just a lot to consider, and I think we're getting there. Organizations are getting there, but I think they also have a lot of work to do. So organizational support, um, the skills of individuals are an important part of health literacy, but health literacy is not only about individual skills. So we talked about this a little bit earlier, how there's the individual literacy aspect, but also an organizational aspect. So, because the reality is health literacy in the US reflects what health systems and professionals do to make health information and services understandable and actionable. So professionals, the media, and public and private sector organizations often present information in ways that make it difficult to understand and act on. Publicly available health information can also be incomplete or inaccurate. And then also recent research has focused on health literacy as one of the critical factors in health disparities. The greatest opportunity for reducing those health disparities are again empowering individuals and changing the health system to meet their needs. Um, And then I really liked this. We cannot expect people to adopt the health behaviors and take the actions we champion without clear communication, supportive activities to build skills, and organizational changes to reduce the demands of our recommendations. So, just something to think about. So, overall, addressing health literacy and some strategies that are evidence based. We love evidence based practice here on the Aging with Andrea channel. um, so, some of those include simplifying and improving written materials that already exist, using video or other targeted approaches to patient education, improving patient provider communication, using computer-based participatory processes, plain language and pictogram medication sheets. And as a result of using these, they've all had positive results, demonstrating that limited health literacy can be successfully addressed, which is good news. Some strong evidence supports involving members of the target audience in the design and testing of communication products improves the outcomes. Studies have shown that picture-based instructions promote better understanding as well of how to take medication and decreases medication errors among patients. And then graphs may be appealing and informative means of communicating health risk information to adults with low numeracy skills. So healthcare system's contribution to limited health literacy. So I have this little picture that kind of depicts, I know I've been at the doctor before, and if I don't know what they're talking about, I'm just lost. There's been multiple times where I do my research ahead of time, and if I hadn't, I would have been screwed. I know, especially when I went to get my antidepressants, I've been studying psychology and things like that for 4-5 years now. And still, when the doctor talked about the antidepressants and the options, it just went over my head. It was terrible. So I can't even imagine if I wouldn't have been prepared, what would have happened. So many factors in the current healthcare system contribute to limited health literacy, including lack of coordination among healthcare providers, confusing forms and instructions, limited use of multimedia to convey information, insufficient time and incentive for patient education, differences in language and cultural preferences and expectations between doctors and patients. It's a big one. And then overuse of medical and technical terms to explain vital information, another really big one. So some strategies, again, I will not say all of these. You can pause and read them if you want. Just using different types of communication and tools with patients, including pictures and models and scorecards to support written and oral communication with patients and their caregivers. Just using patient-centered care, the way that they advertise, actually doing that. So again, I'm not going to read all these, but feel free to pause. Again, I won't say all of these either. If you want to pause it, go for it. But just for community service providers, that's what I have. Feel free to pause it. But I think, again, they're really good strategies and something that educators and community service providers need to continue to consider. Yeah, and then some more strategies for philanthropic, nonprofits, advocacy, academic and professional organizations. Yeah, just including health literacy, developing guidelines. You can read, but I like this one, this last one. Educate policymakers and other decision makers about the need to communicate health issues clearly and about the importance of health literacy and its contributions to improvement in health outcomes and decreased costs. Decreased costs. If you talk to something that I've learned in my classes is my policy class, is that politicians love hearing that whatever you're proposing, whatever program, things like that, policy, whatever, if it lowers costs, they love it. If it doesn't, don't say. So lastly, I just wanted to talk about the STEP approach. So this is an approach to health literacy improvement. So we must share among ourselves and across disciplinary and organizational boundaries, information, findings, program success, and areas for improvement. Technology, we need to be mindful of the digital divide. We must consider technology as an essential tool for improving health literacy, but again, we need to address and understand that not everyone has, that some have a technological barrier. And so we need to work to improve that and make things accessible. Evaluation, more programs need all types of evaluation, especially evaluation that accounts for what's important to different population groups. Partnership, we must create partnership with communities and each other. And then participation, health literacy has its roots in community engagement. We must partner with the people whom we are trying to help. I think that's the biggest takeaway. But yeah, that is the end of my presentation. If you're still here, I want to thank you. So hopefully that opens your eyes a little bit to the issue of health literacy and also how it's impacting the older adult population, but also multiple populations and groups within our country. And yeah, I hope you were able to consider, if you are like a professional, take some of those strategies and consider it. If nothing else, I hope it opens your eyes a little bit and gets you thinking. Yeah, this is a thing that, again, I haven't known a lot about for very long, but I really enjoyed researching it through making this presentation. And yeah, I really enjoyed sharing it with you all. If you have any questions, I mean, feel free to comment. I will do my best to answer any if there are. And yeah, I hope you have a great rest of your day, night, evening, afternoon, whatever time it is. I hope you continue to stay well. Yeah, I will see you all soon. Thank you.